A very good day to all of you. And today, as we had promised, we are again back live for guidelines on patients suffering from kidney diseases. Kidney diseases, they are really widespread in today's era. If I talk about the major reasons due to which the patients are having a damaged kidney, the major reasons are chronic renal failure due to diabetes, that is the diabetic nephropathy, chronic renal failure due to polycystic kidney disease, in which there are multiple cysts which slowly and gradually they damage the kidneys. And if I talk about the third major reason, it is nephrotic syndrome. Nephrotic syndrome is indeed a very major reason for kidney failure in today's era. Then due to hypertension, due to recurrent urinary tract infections, there can be multiple reasons. And one common reason which is really increasing in today's era is IgA nephropathy, IgG nephropathy. That is a disease in which the immune system, which is otherwise meant for protection of our body from external infections, that immune system becomes active against our own kidneys. So there are n number of reasons due to which the kidneys can be damaged. Now, once they are damaged, if we talk as far as allopathic world is concerned, the only method which is there is initial delaying the further damage with certain supportive treatment, and then gradually dialysis, eventually leading to renal transplantation. Dr. Sanjay, if there are any questions, please interrupt me and repeat those questions.
Raj Agrawal wants to know about height growth possible for pituitary hyperplasia.
Raji, as we were discussing in the previous live program, yes, if there is pituitary hypoplasia, there are herbs which can help in height improvement. The biggest challenge is that the the epiphysis of bone should not be fused. What happens is gradually when we age, there is a stage when the long bones of the body they become calcified, so that there is no further chances of them growing. If that hasn't happened, there is a bit fair chance that with the help of Ayurvedic supplements, with the help of Ayurvedic combinations, the height can improve. The ashwagandha and other things which we have mentioned over here, shower, which we have tried, those are basically Ayurvedic or rasayanas. But what we require over here is Ayurvedic Dhatvagni Vardhak medications or herbs. Ashwagandha, Shatavari are tonics which are not bad, which are good. But if it's a clear-cut case of pituitary hypoplasia, then these won't be able to give any good recovery or any good results. What I would request from you is, if you're having the level of hormonal assays of pituitary gland, kindly forward the same to us so that we can give you the best of guidelines. Talking about the kidney diet. When the person is suffering from kidney failure, the major thing which the person should keep in mind is, whenever you are to take any kind of vegetables, boil them, throw their first water out. This helps in removing the excessive phosphorus from those vegetables. Because vegetables are rich in phosphorus, and in a kidney patient, the phosphorus level, it is more. So we have to keep a check on that phosphorus level. This process is known as leaching. So leaching is very important for a kidney patient. Dr. Sanjay, the next question, can you speak?
Alam Khera wants to know, uncle is suffering from CKD, doctor have to suggest for dialysis. Is it possible to kidney?
Alamji, definitely if there is no signs of uremia in your uncle's case, if the blood urea is below 200, if the serum creatinine is below 12.5, without fear you can immediately start with good Ayurvedic treatment. The thing which you have to remember in Ayurvedic treatment is, do not go for any kind of loose Ayurvedic medications, do not go for any kind of metals. It should be more of a herbal treatment. Generally, In Ayurveda, majority of Ayurvedic doctors are giving the same medicines to a patient with kidney stone and the same medicines to a patient with chronic renal failure due to less knowledge and due to less in-depth reviewing of the problem. So what we will require from your end is complete KFT, forward it to us so that we can exactly know that whether Ayurveda can be of help to him or not. What I can assure you from our end is if we are able to do something, we will commit you. And if we feel that no, the levels are pretty beyond toleration of the body, still there are people in which we advise the very first dialysis and then we stop it. So it's not about having the first dialysis done or not. It is about the thing that a person does not have to go for a bi-weekly or a tri-weekly dialysis throughout his life. So a lot can be done in your uncle's case. Forward us the details. Yes, Dr. Sanjay.
हफीजुल नस्कर जी जानना चाहते हैं मेरी मम्मी खाना ठीक से नहीं खा पाती, क्या करें?
हफीजुल जी, मेरी आपसे रिक्वेस्ट रहेगी क्योंकि ये मेरा इंटरनेशनल पेशेंट्स के लिए लाइव है, प्लीज़ आप नेक्स्ट मंडे को मेरा जो लाइव नेशनल रहेगा जिसमें कि मैं हिंदी में रिस्पॉन्ड कर पाऊंगा, प्लीज़ उस पर मुझसे क्वेश्चन पूछिएगा, बट लव टू रिस्पॉन्ड यू। बाकी मैं आपका क्वेश्चन अपने डॉक्टर्स के पास भी फॉरवर्ड करूंगा, दे विल गेट बैक टू यू। यस डॉक्टर संजय, व्हाट इज मिस्टर सतीश आस्किंग?
Satish comfortable in language, Telugu language.
Satish, we will be arranging a call back from you from Priya Raghavan. We are having Priya ji, who is basically conversant in Telugu. You will get a call back from Priya ji. Harjeet, please note down that this query of Mr. Satish has to be forwarded to Priya ji so that she can give him the best of guidelines in Telugu language. So Satish ji, in Telugu language, Priya ji will be getting back to you by the latest by tomorrow. Coming back to kidney disease, the first thing I guided you was leaching. Now the next thing is, since a kidney patient also develops high levels of potassium, so it is very important for a kidney patient to restrict potassium in his diet. Now, potassium is too high in citrus fruits. That is why a kidney patient is generally advised to restrict citrus fruits in his diet. So if you are suffering from kidney disease, the only fruits which are good for you are apple, you can take a bit of guava, you can take pear, and you can take pineapple once in 7 days. Avoid the rest of fruits. Yes, Dr. Sanjay.
Can we eat spinach and green leafy vegetables in kidney disease?
See, if we talk about spinach and green leafy vegetables, the thing which we have to keep in mind is one thing, leaching. We have to throw the first water out. If our phosphorus is high also, then if we are doing the leaching and taking spinach and green leafy vegetable, it won't harm. The second thing which we have to keep in mind is our potassium level. If the potassium is higher, then we have to reduce taking these things to once in a week. Otherwise, we can continue taking this. Yes.
Diet to reduce the high
Reduce
creatinine level.
See, if we talk about diet to reduce the high creatinine level, the biggest thing which we have to keep in mind is that creatinine level. Now, creatinine, what exactly is creatinine? Is creatinine a toxin in itself? No. Creatinine basically is a marker which tells us that what is the exact level of toxin inside our body. Now, if the creatinine is more, this means that the toxins is more. It is the urea which has to be kept an eye on. It is the urea which can cause the major harm. So, if you are to restrict the diet and you have to take a diet in such a way which can be beneficial for you, the thing which you have to keep in mind over here is that the protein which you are taking should primarily from a vegetarian source. The best proteins being either egg protein or cheese. You can take one of these two proteins, either egg white or cheese. You can take these once in a week, twice in a week, at the max 3 to 4 times in a week. Do not take it regularly, and the average quantity to which it has to be taken is 30 to 40 grams. When you will take it, the body will get the exact amount of protein that it requires. You can get a diet chart also from a good dietitian to be more precise. But then, if you are taking more of protein, then urea will increase. If you are taking less of protein, then the body will start glucogenolysis, and still the urea will increase. So you have to take a balanced of protein. Yes. Any other question?
If kidney problem is chronic, how long can I continue without dialysis?
See, if your kidney problem is chronic, you can be without dialysis even if you are not taking Ayurveda. If you are maintaining your BP, you are maintaining your good health, still the kidney will take a lot of time to deteriorate. But the biggest problem over here is if you fall ill due to anything and you have to take antibiotics, if you are having any pain and you have to take painkillers, such things, they quicken up the deterioration of kidneys. So it's always preferable to start with some Ayurvedic supplements, not necessarily from us, from anywhere. But the thing is, every precise detail of those supplements should be mentioned. For example, if I talk about Punarnava, Bohirvia diffusa, it is a herb which is very good for kidney patients, and people around the globe in Ayurveda are using it. But the biggest problem is it is very rich in potassium, and majority of those doctors do not worry to remove that potassium out of Punarnava. Now we over here, when we are using Punarnava, we try to take out the maximum potassium out of that Punarnava, making it safe for long time usage of our kidney patients. So if you are suffering from chronic renal failure, it is always preferable and advisable to take some safe dietary Ayurvedic supplement. For instance, if I talk about our safe supplement, one of them is Viramrit. You can go through the contents of Viramrit on our websites. Something which is safe, which a person can take harmlessly as a supplement. Yes, Dr. Sanjay, any question?
No, sir.
So, I'll further continue with the diet in kidneys. We talked about the leaching process, that is the phosphorus reduction. We talked about the potassium, and luckily, as someone asked, I always mention about the protein intake. Now, if I talk about the Ayurvedic guidelines for a kidney patient, Ayurveda says that take Laghu and Supachyan, the diet which is easily digestible for a person. If I talk about the Hindi names, it is Moong ki dal, Masoor ki dal. I am sorry because I won't be able to give the local names of your countries because I have patients in various countries and the names are different in different countries. So you can translate it through Google. Moong ki dal, Masoor ki dal, Ghiya tori, which is also known as Loki. You can translate it. Then Kaddu, which is also known as Petha. Petha can be taken in the form of a vegetable, it can be taken in the form of a dessert, it is very good for you. Then all kind of capsicum, cabbage, cauliflower, these three vegetables, but with their first water thrown away. That is after the process of leaching. You can take feta, there is no problems about it, but then again, it should be restricted to thrice in a week in a dosage of around 20 to 30 grams. You can take soybean also, again once to twice in a week. So the diet is the most important requisite in a kidney patient. Another thing which you must always remember if you are a kidney patient is that you should restrict the salt intake. The salt intake should be lesser and you can take soda bicarb instead to have a good sodium level. So soda bicarbonate can be taken, which is good for the kidney patient. In small pinches you can take it daily, but avoid sodium chloride. Again, if you are a kidney patient, there is one pranayam which is very good for you, and that is Sitlikaram. I'm just going to do it for you. It's as simple as it. Take out your tongue and take a deep breath inside, like this. The longer the breath that you can take, the better it is for you. So do Sitli Pranayam. It is very good for you if you are a kidney patient. And always keep a check on your blood pressure, because whether your kidney is damaged due to any reason, now that it is damaged, the blood pressure it tends to rise. So it has to be kept in control. Yes, Dr. Sanjay.
Mr. Sheldon William wants to know reason to increase creatinine level and how can control it.
See, Mr. William, the major best reason for the increase in creatinine level can be due to diabetic nephropathy, due to IgG, IgM nephropathy. It can be due to hypertension. There can be multiple reasons for rise in creatinine, but then the underlying reason is that the kidneys are not working now to the desirable extent. So, if the levels have risen by very slightest, then also we have to take it very seriously, because when the creatinine level rise by only 20%, the kidney has lost functionality by 80%. So any kind of rise in creatinine level should always be taken with utmost seriousness. There was just one pranayam, one yogic guidelines, Sitlikaram. I am going to repeat it for you once again. Take out your tongue and take a deep breath inside. This is Sitlikaram and it is very good for kidney patients. And try taking less of body heating medicines. Have a check on your blood pressure, and if you want, Uramrit. Uramrit is a wonder drug for kidney patients. We have packed herbs from around the globe, including Ayurvedic herbs, including Chinese herbs, including certain Unani herbs, and blended them with sandalwood oil for the benefits of all of our kidney patients. So Uramrit is something which you can take without fear, and it will give you improvements in your kidney problem. Yes, Dr. Sanjay.
Mr. Santosh question is, I'm hepatitis patient, can you do in negative?
Mr. Santosh, if you are suffering from hepatitis B or hepatitis C, the common one is hepatitis B, so I will talk about that. We need to have your HBsAg, you can have your viral load, and definitely with the help of Ayurveda, if we go for proper Ayurvedic medications in your case, we will start visualizing a marked reduction in those levels with every passing 2 months. And yes, if you follow the guidelines, there is a fair deal of chance that you can lead a hepatitis-free life. There is no doubts about that. You simply forward the details, and during the when I am speaking to you during this live interaction, you are always requested to forward your numbers, because if you forward your numbers, we can bet back to you people on those numbers. And if you want your confidentiality, in that case, you will log on to our website ompharmaayur.com, ompharmaayur.com. It's our international website. You can post your query from there. You can also directly call on the numbers which are flickering over here. If you call on those numbers, our team will get in touch with you. They will guide you with everything. You can send us a mail on our email ID. There are multiple methods. You can also download our mobile app on the name of ND Care, and then definitely we will keep your data also confidential and give you the best of guidelines. Yes, Dr. Sanjay.
Mr. Albert question is, can Ayurveda reduce the creatinine level?
Mr. Albert, definitely Ayurveda can reduce the creatinine level, and more than the creatinine level, it is the creatinine clearance test which we should always go for. Creatinine clearance test. It's a test in which you need to collect 24 hours of your urine. You have to give it on a lab. The lab will then check how much creatinine your kidneys are excreting out within 24 hours through the urine, and that gives a direct indication of how much your kidneys are working. Generally, doctors don't guide for this test, because this is a test which can immediately tell you whether a medication is working in your case or not. So whether you are getting any kind of treatment done from our center or from anywhere else, always keep a check on 24-hour urinary creatinine clearance. And yes, my friend, Ayurveda has a lot in promise in a patient suffering from chronic renal failure or any kind of kidney disease in which the creatinine is increasing. Ayurveda, if taken under a right doctor, under a technical doctor, in the herbal format, do not take metals in Ayurveda. Generally, the biggest problem over here is people approach quacks. There are so many doctors pretending to be real Ayurvedic doctors over here. They tend to advertise on our channels. They tend to befool the people, giving them all kind of metals. So when we talk about Ayurveda in kidneys, it is Ayurveda minus metals. It's herbs that have to be taken, and they are very safe, and they can really help a person suffering from kidney diseases. Yes, Dr. Sanjay.
माधवी कश्यप जानना चाहती हैं why should patient with kidney disease manage fluid intake?
See, if we are talking about a patient suffering from kidney disease, the fluid intake needs to be managed. What happens over here is the allopathic doctors, or generally the doctors, tend to tell the patient to take less of fluid. That is something which is wrong. I don't believe in that. What is to be done is manage the fluid, and to manage the fluid, what you have to keep in mind is measure at least once in a week, calculate the amount of urine that is being excreted out of the kidneys through urine. For example, if the kidneys has excreted out a urine of say 1 liter in 24 hours, then the maximum amount of liquid that can be given to that patient is 1 liter 200 ml. That means 200 ml more than what was taken. So it is in this way that fluid has to be managed, so that there is no fluid accumulation inside the body, and at the same time there is ample amount of urine to take out the toxins from the body. So manage the fluid with this fluid chart. Do not simply restrict the amount of urine that is being taken, which is generally advised by doctors, which is wrong. Yes, Dr. Sanjay.
Priya Vinod's brother was hepatitis B positive. No other symptoms. I hope he won't get his liver affected.
Yeah, if there are no symptoms of hepatitis, in itself it means that there is a fair amount of possibility that the virus still has not attacked the liver. The only thing which you have to keep in mind is HbEAg should not be more, viral load should not be more, and HbSAg, we should keep an eye on that. Every 6 months, you can go for a fibroscan, and then the most important, if you really want a hepatitis-free life, we are there to help for that also. We can slowly and gradually work under the guidelines of Ayurveda and see how the HbSAg levels go on reducing. But as far as your questions is concerned, yes, if it's not having symptoms, do not worry. That is what I always guide my hepatitis patients. Do not worry. If you are coming to us for any kind of treatment, don't come to us with a fear in your mind, because even if you are not getting anything done, the virus may not cause the slightest of harm to the liver throughout life. So do not worry. Yes.
Sheldon is asking how can I meet you in US or in India?
Mr. Sheldon, if in case you want to meet me in US, I have time to time organized OPDs for my US patients. My next OPD will shortly be updated on my YouTube. It will take a few months for me to be over there, but then I'm having two Vaidyas, trained Vaidyas working under me over there. Vaidya Rajiv Sethi, Vaidya Sulakshana Sethi. Both of them are there in New York on Long Island. They are representing me over there. You can speak to them. Their numbers will be shared by my team with you. After the show, you can share your number with us. They will be getting in touch with you, and they can take your complete history. You can meet them on my behalf, and from here they will discuss your case with me, and I'll try to give the maximum and the best guidelines as per my knowledge to you. And once I'm over there in US again, I would love to meet you over there. Yes.
Simranjeet Kaur case is mother's Alzheimer's patient. I want to know best treatment.
See, if we are talking about Alzheimer's, the best thing which I always guide my patients is start cooking in coconut oil. Coconut oil is the best for cooking in Alzheimer's. So start cooking in coconut oil. Then if we talk about the common remedy, methi. Methi in the form of seeds, methi in the form of, you can say, vegetable, is very good for a patient who is suffering from Alzheimer's. If we talk about herbs, there is Medhyrosaina, Manduk Parni, that is the Centella asiatica, then Shankpushpi, Pleurocolvus convolvulus, then there is Mulethi, Glycyrrhiza glabra, and last but not the least, Giloe, that is Tinospora cardifolia. They are all very good medhyrosains, and we have clubbed all of them in Mem Plus capsules that we are having over here. Then there we are having a combination named Breno A. Breno A. A stands for activators, A stands for Alzheimer's. So Breno A is a miracle medicine that we have prepared for Alzheimer's patient. Along with Breno A, You can also proceed for various panchkarma therapies in her case. So coconut oil, methi, medrosinus, brenoe, all are very good for her. And you can always reach us out. You can go through my video on Alzheimer's, which I have specially mentioned. There are a lot many things that you will get from there also, which are very good for your mom. Yes.
Sukhchan Singh, I have needle-like pain in my both kidney. Creatinine level is 1.14.
See, Mr. Sukshan, if you're having needle-like pain in your kidneys and there is shooting pain inside your kidneys, first of all, the pain should be in inguinal region. If the pain is in your inguinal region, the pain can be due to kidneys. If the pain is not in your inguinal region, the pain is on your backside, it may or may not be due to kidneys. What I will advise you is go for an ultrasound scan. Do not delay it. And take warm water. To be on the safer side, at times there are certain renal concretions there inside our kidneys. Those renal concretion can cause pain. Concretion is a stage which is prior to a kidney stone. So there can be renal concretions. Take pineapple juice, take kulth ki dal, which is also known as horse gram. Take lots and lots of warm water. If you want help or support from any kind of medication, there are renal care capsules that we have for this condition. So you can try all of these and you will definitely get results. Yes.
Mr. Raghavan, KA, when can I meet you in Dubai? My son has Parkinson's in initial stage. I have heard a lot about your therapies. Would like to contact with you for your guidance.
Mr. Raghavan, thanks for the question, and I'll be there in UAE in January. In January, I have been invited by Ayush department in India for a talk in UAE. So when I'm in January, it will be in the second week of January, most probably. Very soon, my team will be updating with you with the dates also. And when I'm over here, I would love to meet you, and I will definitely guide you about all the things. Till that time, you can interact with me through my video conferencing sessions, and we can guide something to your child. I suggest one thing which you can do right at your places, and that is crunch. Crunch. Mucuna pruriens is a wonder herb for Parkinson's. Try crunch. Crunch beach is very good for your child. You can reach out to us. We can help you out with crunch beach. So that is something which you can start immediately, and in January you can meet me in UAE. Yes, Dr. Sanjay.
Felix is thanking for our treatment reason.
Thanks a lot to you also, Felix, for having faith in Ayurveda, having faith in us, and I would also like to thank all of our viewers who were today with me for the live session. I will be live again the next week, and my genuine request to all of you who are live is I will always try to answer the maximum of questions, and if I miss out on any of the questions, my team will always reach you back after my live session. Our aim over here is to give Ayurvedic guidelines, quality Ayurveda, increase Ayurvedic awareness. The support which we want from your end in this endeavor of ours is please share our YouTube channel with the maximum people. We will always try to give the best of guidelines. Our motive of being live is not about selling, because Ayurveda is not about selling of medicines. As is said, Swasthasya swasthya rakshanam aturasya vikar prashanam. Ayurveda believes in disease prevention rather than disease curing. So, through this channel, we would regularly be interacting with you and guiding you with disease prevention. So, thank you once again. Have a good day. Stay blessed.